This morning, the National Institute for Communicable Diseases confirmed that a suspected case of COVID-19 has tested positive.
The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days.
Schools will be closed from Wednesday, 18th March.
You know, I wish I could say that we're going to be opening on the 1st of April, but the likelihood is slim.
As South Africa enters its 589th day of lockdown, upon reflection, the 2020 lockdown level 5 restrictions came at a time of major uncertainty as little was known about COVID-19, commonly known as the coronavirus. On the 23rd of May 2020, a directive issued by Minister of Higher Education, Science and Technology, Blade Nzimande, stated that 33% of university students will be required to return to campus. This included final year students required to do clinical training. Medicine students are part of this group as they are expected to undergo clinical training to prepare them for work in the hospital. Students studying medicine have faced the challenge of putting their studies and calling to medicine first as they do their clinical training during a pandemic. From fears concerning the virus and getting loved ones at home sick, to the mental stresses and burnout that affects many health practitioners and medical students around the world, the COVID-19 pandemic has exacerbated both of these. Being recalled to work in what is considered by some as one of the most infectious sites, the hospital, is narrated by fifth-year medicine student Moyo.
Hello, my name is Moyo Lawal-Solarin and I am a school-leaving, or what they call a mainstream, fifth-year medical student at Wits University. There was definitely quite a bit of anxiety and fear around going back into the clinical space in the midst of a pandemic. So we actually didn't have a lot of clinical exposure in our fourth year because of the lockdown and having to go home and do remote learning. And so fifth year was our first contact in the clinical space and also our first contact with the pandemic and being on the front line. So there was definitely a lot of fear around being exposed to patients and possibly contracting COVID and taking it home if you work from home or live at home, or giving it to loved ones or friends. There was a lot of, I'd say, like paranoia amongst students about what to do in terms of protocol, how do I get time off. But our faculty did kind of ease that with telling us this is what happens if you do contract COVID, and they did provide us with PPE. So that was helpful. So we were definitely very kitted out in terms of masks and face shields, but there was still a lot of fear around it, especially before we had any vaccine.
The pressure of medicine school on the mental health of students was also addressed.
Medical school and its impact on anyone's mental health is something that I know people are aware of, but I don't think people talk enough about in terms of their own experience and how they get through it and what it actually does to people's mental health. And it's all on a spectrum. Some people are really susceptible to being very negatively impacted by the stress of medical school, and other people find that they cope a bit better. But I can say that I'm almost confident in saying that every medical student at some point or another, including myself, has been affected by medical school, whether it's the stress or being away from home or having to be on the front line during a pandemic, or just finding that it's quite overwhelming. At some point or another, everyone's been affected to a lesser or greater degree. So, I mean, there's a variety of things that people can suffer from, but I'd say the most prominent things are definitely people feeling depressed or anxious. And I think the pandemic definitely exacerbated that, probably during the lockdown or the break. Some people's home environments, and it's a reality that we have in this country, some people's home environments aren't as conducive to learning, and the pandemic and being isolated and having to continue medical school can really just add to anyone's mental health condition. And you're isolated, and so you really feel alone, and that can worsen anyone's mental health state. But it's really interesting because the closer that you are to the hospital, or the closer you are to COVID patients, the more careful you are. You're constantly wearing PPE, you're constantly washing your hands, you're very, very careful. And so interestingly enough, you're actually less likely to catch COVID in those scenarios. And you're more likely to catch it when you leave the hospital and you let your guard down, and now you take your mask off and you're talking to your friends and you're hugging each other, because in your mind you're assuming this person doesn't have COVID, but they very well could. And so it's really interesting that it's often outside the hospital and outside the clinical space that medical students and doctors end up catching COVID.
Moyo's story is just one of thousands of medicine students around the country. This podcast episode is a part of the 2021 In-Depth Reporting Project, Year of the Student. The full project with articles and other multimedia can be viewed on witsvuvuzela.com. This is a project produced by the Honours in Journalism class at the Wits Center for Journalism. Please see the show notes for full credits.